In our last clip, we are now more than halfway through the procedure of an amputation. Of course, if you have a basic idea of it, you've got to cut through the skin, the muscle, the fat, all that, secure that out of place. Now you've went ahead, you've taken your teniculum screw, a hook-shaped tool that would be used to pull out the arteries, capillaries, and veins, tie them off with silk ligatures. And one thing that I forgot to mention in the last clip, you'll forgive me, was that you would then have to go through with the bone saw. And once that was cut through, you could then pack in that mixture that I told you about, which was a combination of cotton fibers, or tow as it's sometimes referred to, and flour. This is an early Lenten mixture, and this would help to coagulate, stop the blood flow, and it would also allow for proper drainage. And this is interesting because unlike modern hemostatic Lenten, which has to be changed on a frequent basis, this was biodegradable. So once you had secured the wound, it's going to be absorbed by the body, and it's actually going to ensure that the amputation heals up a lot better and a lot quicker than what the changing out of the modern hemostatic Lenten would be otherwise. Now, once you have went ahead and you've got all that taken care of, you now release the leather belt, push the muscle fibers, the fat, and the skin back into place, and now you have to sew. But there's a few problems. One is that the physicians did not like to sew, and also they noticed that over the years, sewing could lead to infection afterwards. So what they ended up doing was they would use a superglue-like mixture called isinglass, which is the byproduct of purified air bladders of fish. And once they had taken that isinglass and put it in a bowl, they would soak the bandages in it, fold the flap of skin over, wrap it up. There you go. Your amputation is complete. But that procedure is kind of part and parcel when talking about this time. The one that fascinated me the most when I was studying this was the practice of trephination, used for those who had suffered some kind of cranial trauma. And now, it's not going to be a pretty sight by any means, but hey, what is in a hospital? If you started to exhibit symptoms after you had received some kind of head injury of unbalance, dizziness, unequal pupil dilation, so on and so forth, then you know that there is a buildup of fluid on the brain. And so what the physicians would do is they would go in, and they knew the spots that they had to drill into the skull with. They would shave the hair out of the way, take their knife, cut the skin, peel it back on either side, and then with their trephination tool, which is kind of like an auger, they would drill the hole into the skull and open it up. And you think, how horrible is that? That's excruciating. Interestingly, though, although the body is covered all over in millions and millions of nerves, the skull is not one of them. So the patient, although he would feel the sensations of fresh air rushing into this hole in his skull or what have you, he would not really feel any pain past that point. But from there, once the hole was opened up, they would have him lean over and they would allow the fluid to drain. They'd keep an eye on him, make sure that he was progressing according to plan. And for the average American physician, once the fluid was drained off properly, they would go ahead, pack in a Lenten mixture, and re-stitch the scalp together, or stitch the scalp back together, and then allow the skull to heal itself, as well as allow the hair to grow back. But the Spanish physicians, they just couldn't leave that hole wide open. You can't leave well enough alone, so to speak. And interestingly enough, what they would do is they would take a Spanish silver dollar, drill little holes around the outside of it, and then they would pound it in to the hole in the skull. Why they did this and what follows next, we're going to discuss in our last and final clip on surgery and sanitation of the 18th and 19th century.